I'm Kate from Rehabilitation Podiatry, and we're doing a mini series on some common questions we get asked in clinic. Today's video is, I've seen everyone, why am I not getting better? We have patients that feel like they have seen every clinician and specialist and that they're not getting anywhere with their pain. When we see these patients, we've got to remind them that the pain that they're feeling is real. It is your body and your brain telling you something's wrong. Whether it turns up on an X-ray or an ultrasound, doesn't matter. You feel it, it's real. So when everybody else has looked at your foot pain in your foot, and they've ticked all the boxes and they can't find anything wrong, or the treatment they used hasn't made a difference, that's when, as a rehabilitation podiatrist, I want to step back and look at something else. So if your pain isn't because of a crush injury that isn't healing, you don't have an open wound that's gushing out blood and isn't sealing up, your body is designed to heal. So if it's not telling you that it's all better because you've got this pain screaming in your ear or poking you all the time, then we need to find out why. What is the block? And maybe it's further up the pathway. Maybe it's actually in a completely different place altogether. Is it a referred pain? Is it a stress signal because your body doesn't feel safe and it doesn't want you to do the same injury? Or it feels like it's about to be injured. So a good example of that is cramp. If you're going into a range that the body doesn't feel safe with, it'll give you cramp to stop you in your tracks. Your nerve might give way, and so you feel like you don't trust your body, and therefore you do less. Your muscles will tense to hold on to something instead of adapting and flowing with what you're asking it to do. Building strength, building endurance. If you were to mimic somebody that is in stress or anger, you see a physical response to those emotions and those feelings. And so we need to take a step back and look at all these different elements. So as a rehabilitation podiatrist, once we've determined maybe your foot pain isn't your foot, I want to look at other things. I want to look at your back and your hips, which help your foot. Is it a pinched nerve? Is it the fact that your feet are overworking and we actually need to find out why your body feels so unsafe in that area? It's because something else isn't working that should be. Or it doesn't feel like it wants you to run because it knows you're going to hurt yourself because it already feels like you're about to do that. So it doesn't want you to do that. So it's going to give you these signals, these little pull of the calf, a little pain here, a little sharpness there, to stop you doing something that it doesn't like. So your body gives you these pain alerts, either because there is tissue damage, because it doesn't feel safe, something else is a problem and it's trying to get your attention because we didn't listen to all the other ways it tried to communicate with us, a little numbness, a feeling of weakness, a feeling of stiffness in the morning, and actually address those things. So when a patient comes in with this situation, I'm going to look at a few different things. I'm going to look at how their body is functioning, not just where the pain is. Are their nerves communicating properly and effectively and they're not getting pinched or irritated? Are their emotions and their reactions to situations within tandem? In other words, is there a fear of re-injury? Is your body feeling unsafe during an activity, and maybe we need to address the activity that you're doing, the way you're running, the way you're recovering if you're not recovering well? Are you taking care of the tissue in a way where your muscles feel like they have lots of options? Are you tensing to do certain things instead of just recruiting other muscles so that it has not 2 people moving the couch, but 20 people moving the couch? Are we looking at your brain, which is the one that's telling you something is wrong? Maybe it's actually not communicating well with your body and there's an issue there. Is the body giving you mixed signals? Or maybe it's getting stuck on a signal that it hasn't been able to help repair. We might look at tolerance building, teaching the body that it's safe during an activity because you've proven that it can do something safely. And you can build up endurance that way, you can build up strength that way, you can build up a lot of different more adaptable movements for your body to feel safe and cope, especially with balance. So when I'm seeing patients that have had an injury and they just can't get through the last bit of pain and nothing seems to be helping, that's when we can look deeper, we can look at another part in the chain, and we can look from a different perspective of what your body is trying to communicate with you. Whether your pain doesn't show up on an X-ray and ultrasound, it is real, and we need to turn off that distress signal in a way that it doesn't just turn back on somewhere else. I'm Kate from Rehabilitation Podiatry. I'll see you next time.